Today we'll be talking about cranial nerves and the assessment of cranial nerves. Cranial nerves emerge directly from the brain, and we know that we have 12 pairs of cranial nerve. These cranial nerves relay the information between brain and the parts of the body. So we'll just see which all are the pairs of cranial nerves. So we know that we have olfactory nerve. Olfactory nerve is responsible for the smell. Then we have the optic nerve. Optic nerve is responsible for the vision. Then we have the oculomotor nerve, which is responsible for the eye movement and the pupillary reflexes. Then we have the trochlear nerve, which is responsible for the eye movements. Then we have the trigeminal nerve, which is responsible for the facial sensations and chewing. Then we have the abducens nerve, which is again responsible for the eye movements. Then we have the facial nerve, which is responsible for the face movements and the taste. Then we have the vestibulocochlear nerve, which is responsible for the hearing and balance. And this nerve is also known as auditory nerve. Then we have the glossopharyngeal nerve, which is responsible for the throat sensation, taste, and the swallowing. Then we have the vagus nerve, which is responsible for movement, sensation, and the abdominal organs. Then we have the sensation in the abdominal organs. Then we have the accessory nerve, which is responsible for the movement of the neck. And then we have the hypoglossal nerve, which is responsible for the tongue movement. So now in the upcoming slides, we'll see how can we assess these nerves in the functioning of these nerves in our patient. So we do the examination of the nerves as per the number of cranial nerves. Like number one, we assess for the olfactory nerve. So olfactory nerve is a sensory type of nerve and this is responsible for the smell. तो इसको assess करने के लिए हम क्या करेंगे? We have to bring with us the familiar kind of smells. The smell should be familiar to the patients, like the smell of coffee beans or the smell of lemon. And we have to ask the patient to close his eyes and then we have to administer that smell in front of the nostril of the patients. Preferably, you have to ask the patient to close one nostril and then use another nostril to find out the smell. And we can change the smell for the assessment of the second nostril. And if the person is able to identify the smell correctly, it means her or his olfactory nerve is working normally. The second nerve is the optic nerve, which is again a sensory nerve, and this is responsible for the vision. इसे assess करने के लिए we can use the Snellen chart, because through this Snellen chart you can see the visual acuity of the person, or we can also use the ophthalmoscope, which is used to assess the fundus, or we can also assess the light reflex. Then the third one is oculomotor nerve. The name is saying it's a motor nerve, right? So this is responsible for the extraocular eye movement. So इसको assess करने के लिए we have to assess the patient's extraocular movements with 6 cardinal position of the gaze, like 1, 2, 3, and 4, 5, 6. So these 6 cardinal positions, the patients will be made to look. And if the person is able to do it, it means this oculomotor nerve is functional. Then the fourth nerve is trochlear nerve, which is again the motor nerve. So basically, we assess the trochlear nerve, abducens nerve, and oculomotor nerve all together. So हमें third, fourth, or sixth nerve को assess करने के लिए we have to make the person to perform the extraocular movements in the 6th cardinal position of the gaze. Then we have the trigeminal nerve, which is the 5th nerve, and it has 3 branches. Like we have ophthalmic branch, we have the maxillary branch, and we have the mandibular branch. And for like assessment of the trigeminal nerve, what we can do, we can palpate the temporal and the masseter muscles, or we can ask the person to clench his teeth, or we can assess for the corneal reflex. Corneal reflex को करने के लिए what you can do, you can have a clean wisp of cotton with you and you can just try to touch the outer canthus of the patient's eye. And if the person is having a blinking reflex, it means the corneal reflex is positive. The same thing has to be repeated over the another eye also. Or we can touch the forehead, cheeks, and chin with the cotton wisp, and then we can ask the person, like person will be closing his eyes, will be touching these areas, and will be asking the person to point out where it was touched, just to see the sensation part. Then coming towards the 7th nerve, which is the facial nerve. which is a mixed nerve. It performs the motor functions also and the sensory function also. And this facial nerve is responsible for the expressions, facial expressions of the person. So we can tell the person to like do certain kind of facial expressions, like he can frown, he can he can puff the cheeks, or he can smile, or when the person is talking to you, you can see the movements of the face, because usually when we talk, we will be having certain kind of facial expressions. You can see the my expressions also. It means the facial nerve is working normally. And also you can identify the taste, like for which what you can do, you can keep the familiar kind of food taste, like salty or sugar. You can keep over the anterior two-third of the patient's tongue, and the person will be asked to identify which type of taste was there. So it means the facial nerve is working normally. Then we have the eighth nerve, which is the vestibulocochlear nerve, or the auditory nerve. This nerve is responsible for equilibrium and the hearing part. So we can ask the person to stand in front of us with the eyes closed, and we have to see that the patient is able to maintain that posture for a few seconds, or around a minute or not. And if the person is not able to maintain the balance, it means there is some kind of problem in the balance of the person. At the same time, we have to assess the hearing acuity of the person, for which we can perform the Weber's test or Rene's test. Weber's test and Rene's test are performed with the help of a tuning fork, which is like to assess the lateralization of the sounds, or the air conduction and the bone conduction. At the same time, when we talk to our patient, the person is able to listen to us and he is responding well. It means he has proper this hearing acuity. At the same time, what we can do, we can just use a whisper test also. Like our patient ke piche jaake, you're trying to whisper something in his ear and ask the patient to repeat it. If the person is repeating the same thing, it means he has proper hearing acuity, and the same thing can be repeated in the another ear also. For the watch tick test, what you can do, you can have the watch which has the tick 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 sound, and without showing it to the patient, you can just bring it towards the back of the, like you can stand towards the back of the patient, and you can bring the watch in front of the patient's ear without patient noticing what the object you have in your hand. And then the person can tell you which kind of sound he's able to listen, like it is a tick tick sound of a watch or not. Then we have the ninth nerve, which is your glossopharyngeal nerve, which again is a mixed nerve, performs sensory as well as the motor function. So for assessment of this, like we have to identify the taste. इसमें आप क्या करोगे, 1/3 of the tongue पे you will be keeping some of the familiar object like sugar, salt, lime, etc., and ask the person to identify the taste. If he's able to do, it means the glossopharyngeal is normal. At the same time, you can assess for the gag reflex also. So for the gag reflex, what you can do, you can have a wooden spatula which is clean or which is sterile, and you can just try to put it inside the patient's mouth, and you have to depress it for the like the tongue has to be depressed. थोड़ा सा से आगे लेके जाओगे, the patient will be having a gag reflex, like a vomit type of reflex. It means the person's glossopharyngeal nerve is working normally. Then we have the vagus nerve, which again performs motor as well as the sensory functions. And it is responsible for the sensation in the pharynx, larynx, and the external ear. It is responsible for the swallowing. It is also responsible for thoracic and abdominal visceral activities. So for the assessment of which, again, you can go for the assessment of gag reflex, or like it is also assessed as of your cranial nerve, your ninth, or the glossopharyngeal nerve. Then you have the 11th nerve, which is the spinal accessory nerve, which is a motor nerve, and this is responsible for the movement of neck and the shoulder. इसको assess करने के लिए what you can do, you can ask the person to shrug his shoulder. Shoulder shrug का मतलब है patient को आप थोड़ा सा shoulders को ऊपर करने के लिए बोलोगे, and then you can also give some kind of resistance with your hands over the patient's shoulders, and try if the person is able to move the shoulders against your hands, against your resistance or not. This is to assess the strength of the trapezius muscle. or you can ask the patient to push chin against the hand. आप क्या कर सकते हो patient के you can just keep the hand like this and try the person under the chin of the person and try to tell the person to try to resist your hand. So this is to assess your spinal accessory nerve. And then we have the last nerve, the 12th nerve, which is the hypoglossal nerve, which performs the motor functions, and it is responsible for the tongue movement. Okay. So glossopharyngeal and facial are responsible, facial nerve are responsible for the taste sensation, but hypoglossal being the motor nerve, it is responsible for the movement of the tongue. इसके लिए what you can do, you can ask the patient to move the tongue side to side. इस तरह से बोल सकते हो, या फिर उसको you can also like place the tongue depressor over the patient's tongue and ask the persons to move against that. If the tongue is able to move properly without any resistance, without any problem, it means his hypoglossal nerve is also functioning properly. So that's it for today. We talked about the cranial nerves and the assessment of cranial nerves. Thank you so much.